We're talking with, Andrew here from Fertility Associates or Specialist Associates?
Associate, yeah.
Fertility Associates. He's making babies. How long have you been making babies for?
I've been in this industry for over 25 years. Actually,
Okay.
I'd have to stop and think about it. But yeah, a long time.
That is
That's a
long
lot of
time.
babies.
Tell me what you do, how you do it.
So my role, I'm a fertility specialist. So I see patients each day who perhaps have been struggling to...
Women.
Women and men.
Oh, of
we have
course.
to remember that it's not just a woman's problem. It's something that
Yeah.
affects both men and women. In fact, the majority of the time there will be something going on with both men and women. So we always like to see people together. Of course, we don't just help men and women. We also help single women, same-sex couples, lesbian couples, gay
Yes,
couples.
yes.
We're basically just about helping people create families.
Generally.
Yeah.
I love that. I love that you're making babies. It's funny old thing, isn't it? You spend all your life, well, your early life trying not to have babies, and all of a sudden when you're married, I can have a baby, right? Out go the pills, out go everything. It is a weird thing. It is a very weird thing.
It's something that, a lot of the patients that come to see us, we highlight the irony that you spend your teens and 20s being conditioned to think that you just have to look at someone and you'll get pregnant, and then the reality is, for many, it actually takes a lot longer than you'd like. The average age that we would see would be between 35 and 40. Like often these are couples where the woman has waited a bit longer to start trying, and there are lots of really valid reasons why that might have been the case. But we'll see patients from in any age group that are...
So is there any
reproductive
truth
age.
in, as you get older, it's the
It's
eggs,
harder.
the egg supply?
That's right.
Drops off?
You're only born with so many eggs.
Yes.
So it's not just a quantity thing, but the quality reduces as well. So, if you're born with all your eggs pre-formed, you're not making any new ones.
No.
So,
That's incredible, isn't it?
yeah.
Nature is just so incredible. So the other thing I was going to ask you too was the age of the people and male versus female. What's the percentage of men having problems versus women? And I dare say in 25 years, you've seen a shift.
there's been the actual underlying causes are relatively similar. What we have noticed is women are definitely waiting until later in life to start having their first child. So now it's about 31, 32 is the average age of first births. In terms of the split between men and women, roughly 30% of the time there's a female problem, 30% of the time a solely male problem, another 30% is both at the same time, and then the remaining 10% is unexplained. We're not quite sure why it's not happening, but unexplained doesn't mean can't be helped.
So give me some more information about what you actually do. Like we get the eggs and the sperm and then we put them in a petri dish and go mixy mix.
Well, sometimes that will happen, but if we go back a step to what you were saying before, if you've got a couple who perhaps struggling, things aren't happening easily for them, the most important first step is to go and see someone that actually knows something about it. As
The experts.
one of the problems you have is as soon as people sense that you've got a fertility problem, it's like an unsolicited invitation to start receiving advice. So first and foremost, see an expert. We'll get some really basic, easy to do tests done. Often it's a blood test for the woman to look at some hormones, sperm test for the guy, and then we'll figure out a plan, because that's what most people need is a plan, a pathway forward. Some of our patients might benefit from some further tests or surgery or some lower key treatments, maybe some medication to get them ovulating, maybe some intrauterine insemination, or being here at Fieldays, like AI. In fact, a lot of my mates joked with me when I told them, we've got a stand at Fieldays. They'll say, are you going to be next to the AI stand? And I said, well, we may well be, I don't know.
That would be so funny, artificial insemination. But it makes sense. It makes total sense.
Yeah. There is public funding for fertility assessment and treatment. So if a couple is worried that they are having success getting pregnant, the first port of call would be often their GP. And if they've been trying for more than a year, they can be referred to Fertility Associates for a publicly funded assessment. So it won't cost any money, and they'll see an expert, they'll have some tests organised, and then they'll also be assessed to see if any treatment can be funded as well. So yes, there is public funding, but the key thing is to get help. That's the most important step.
Do you have branches in throughout New Zealand or?
Yes, yeah. So we have main clinics in all the main centres. So here in Hamilton, Auckland, Tauranga, Wellington, Christchurch, Dunedin. But we also send our specialists out to the regions. So we have, I think it's 20 odd regional clinics. Give or take, yeah, 18 regional clinics. So myself, I've been going to Hawke's Bay for the last 17 years every month.
Okay.
We've got clinics in Queenstown, Invercargill, Rotorua. Yeah, we've got the country covered.
Excellent. We like the sound of that.
Yeah.
And of course, birth rates are on the downhill.
Unless we have an increase in the number of babies women are having, our population will struggle to maintain. It is a serious problem, not just facing New Zealand, but all around the world. And various governments are recognising that we need to help support people who need fertility treatment, because we do need more people in the populations. If you talk to anyone that is experiencing infertility and they're told that they have to just stop thinking about it, internally they just want to punch you in the face.
Absolutely, I can imagine. How many times do women, shall we say, have IVF before one sticks? Is it we?
Yeah, so if we look at success
average.
rates, on average, we would say that for women 38 and under, if they have up to 3 attempts at IVF, 80% will end up with a baby.
So how many first off?
So about 50% will only need one go, 70% might need 2, 80% could need up to 3.
That's good though, isn't it?
So that's a really key message, that unfortunately not everyone will nail it first time, so to speak. Doesn't mean that they're not going to get there.
Yeah.
But we need to provide care that supports that couple to, pick themselves up
Encourage
on
them.
the canvas and keep going.
Yeah, you'll get for sure.
Just in the same way you wouldn't expect to cure your cancer with one bout of chemo. You're there for a program of
That's
treatment.
a really good analogy too.
And so you need to keep going, because
And the success, excuse me for interrupting, but the success of carrying that child is
should be no different for that woman than anyone else. I mean, there might be some problems that come with issues that will crop up in pregnancy as well, but that's why seeing an expert's so important, because we can also map out a plan to deal with that as well. There are a few women who maybe it isn't safe for them to carry a baby, and that's where surrogacy comes in. But that's a very small minority. Most of the patients that come to see us will go on to carry their own baby.
brilliant. You do wonderful work.
We love our jobs.
Oh, yeah, I can tell. You've got all the stats, you're just all about it. That's great, and it's some really good information for me to take back to my son too. Somebody knows somebody, all the time. It's a bit like the earthquakes in Christchurch. Everyone knows somebody,
Yeah, absolutely.
And fertility is the same. I was a flight attendant with Air New Zealand for 1,000 years ago, and most of the girls who tried to get pregnant couldn't get pregnant. Mind you, these girls were a lot older too. I mean, they were late 30s.
Yeah, age is a significant
Factor,
factor, and that's probably the most important one of everything. But I guess the key thing we would want anyone here today who's worried about their fertility is seek help. And to that point, if they do come and visit us at our stand, we've got these cards with a QR code that if they scan it, they'll be able to book a free nurse consult. So we have a team of expert fertility nurses that every day will be online and on a phone call where someone who's perhaps not quite ready to come into the clinic and see a specialist like myself, but
Maybe just want to ask a few questions.
maybe wants to ask a few questions, get some expertise, advice from someone that knows something about it. We have these free nurse consults available, and so
That's
we would
amazing.
encourage anyone who's worried about this to come and pick up the QR code or get on our website and
Get on the website and talk to those lovely people down at Fertility Associates. Thank you, Andrew. You've been a
thanks, Phil.
star.
No
You've
worries.
been a star.
Happy
All
to-
about making babies.
let's make some more families.
Let's do it. Thank
All
you.
right, cheers.